Hi, Kaylie. This is Stephanie Boggs, and I will be providing feedback on your service learning presentation about your volunteer experience at the skilled nursing facility. I wrote my answers down as I was watching your video to ensure that I didn't forget anything and that I had my thoughts together. So I'm going to read these back to you just because I think it's easiest to make sure that I'm hitting every point and that I'm adequately giving you the feedback that I had as I was going through your video. My goal is to share what I noticed you did especially well, give you a constructive suggestion, and then end with some points I personally appreciated and related to. One example of a strength I noticed in your presentation is how you truly integrated occupational therapy's core values into your volunteer service. I believe through your interactions, particularly with the client you mentioned had physical limitations but enjoyed getting her nails done and being able to sit and share stories with you, you practiced altruism because you were concerned about the well-being of her. Your services went beyond just painting her nails. You allowed this client to be seen and heard, and I'm sure this gave her a sense of value and meaning. Your services demonstrated your ability to practice justice and dignity because even though she had some physical limitations, it did not stop you from providing her services. You respected her in a way that recognized her value to society. Another strength you presented was your ability to advocate for your clients and problem solve. You mentioned how some of the clients expressed concern about how long their nail polishes would last. You recognized this and advocated for the clients by suggesting to the director that maybe trying a different kind of polish, such as the gel polish, which you knew from personal experience would work better, might be the way to go. This really highlights some strong qualities you possess that will truly propel you as an OTA. You were able to listen to the client's wishes of having their nail polish last longer and use your own experiences with the gel polish to come up with a solution, which was great problem solving. One item of constructive feedback I have is that your slides had a lot of text on them. I had this exact same issue. It's so hard to answer the questions thoroughly in a concise manner with bullet points. A suggestion I have for you in the future that worked for me was writing a script with the lengthy answers that you can read from, but then perhaps putting the condensed version or bullet points on the slides to make it easier for the reader to grasp the key points. One thing I particularly enjoyed was hearing about your role and how you integrated autonomy and cognitive engagement by allowing the individual's structured choices, such as choosing the polish color. This was a great idea, and I'm sure it made the patients truly feel as if they were part of the activity and that their needs were being seen. As we begin our journeys as OTAs, it will always be very critical to ensure that we are practicing client-centered therapy and allowing our client to feel as if they have some autonomy with decision-making and that they are truly being heard. Another thing I really enjoyed about your presentation and something I could relate to was the passion you expressed by your volunteer experience. You could tell that you truly enjoyed your time spent at the skilled nursing facility and you appreciated the impact it had on you as well. Being able to truly help others can have a big influence on how we see ourselves and how we feel about ourselves as well. You can tell how compassionate and caring you are and how you are fueled by being able to help others and make a positive impact on their lives. Something I believe we both share is our ability to empathize with others. I learned that working in a skilled nursing facility is much more than just physically helping with tasks. In these types of environments, we actually make a big difference by helping with their social and emotional well-being. You gave me some great insight on how to use my empathetic personality to make the residents feel connected and understood by engaging with them and allowing them to share their personal stories. You reminded me how important it is to practice my client-centered approach because each client you come across will be unique in their own way, and it is up to us to adjust our approach in order to best help the specific client. Overall, you did a fantastic job with your presentation. It kept me engaged the whole time, and the way you shared your information made it interesting learning about your volunteer experience at the skilled nursing facility. Great job.